This morning, we continue our coverage for Breast Cancer Awareness Month. A brand new study by MedStar Health found 60% of women aged 40 and up are not getting their yearly mammogram. When asked why, most said they've had normal mammograms in the past. And those statistics come even though 75% of the women surveyed say they are somewhat to very concerned about their breast health. I recently sat down with Dr. Lucy De La Cruz, the chief of the breast surgery program at MedStar Georgetown University Hospital. And she says it's hard to hear the results of that study because tools like a mammogram can help catch cancer early on.
I've had patients and I've had friends who have been on the high-risk screening and then we find something. But we're able to find it early and we're able to help them and we're able to save them and we're able to give them a better outcome.
Health experts say a normal mammogram the year before is never a reason to skip out on your next one. Meantime, last month, the FDA implemented a new rule that requires patients to be notified if they have dense breast tissue. And that is typically a factor that puts women at higher risk of breast cancer.
I think it's one of those conversations that if you do have that on your mammogram, if you see you have heterogeneously dense breast, you have extremely dense breast, you should definitely see a breast surgeon. Or see one of, for example, we have a high-risk clinic here that's run by our NPs, and they see patients like that all the time. And then we can have a discussion, we review it with the radiologist, and then we determine whether they need an MRI or not.
And Dr. De La Cruz says a lot of times fear is also standing in the way of women getting that yearly screening, but it's important to have a team of providers that you trust to help with your health journey.
I tell patients that having a cancer diagnosis is scary, but thankfully a lot of women, and most women actually do well from surgery, do well from treatment, and they survive.
And one more note about that study, 18% of women said they skipped their mammograms because they don't have family history. But doctors say most breast cancers are diagnosed in people with no family history, so that should not be a reason to delay your mammogram.